How to use the Easy Abutment system from Thommen Medical. This video is part of the Thommen Medical e-learning video series. The Easy Abutment set provides abutment level simplicity and includes everything you need from a restorative and laboratory standpoint. We start by removing any debris from the screw head that may have formed in the healing cap or gingiviformer. We use a sharp explorer to do this. We then align the mono driver with the long axis of the implant, and using apical pressure, we push down on the driver to keep it fully seated as we unscrew the gingiviformer. The screw carrying ability of the mono driver will allow us to lift the gingiviformer up out of the implant. We clean and dry the internal aspect of the implant with water and air. We then insert the easy abutment into the implant. Some clinicians may prefer to carry the screw and the abutment on the driver itself. You can securely connect the abutment screw to the mono screwdriver by pressing firmly. This will allow you to carry the screw directly into the patient's mouth. We place the abutment screw in the easy abutment with the mono screwdriver. Want to be sure that the abutment is properly seated before we begin tightening the screw, so we check that there's no debris and also no tissue impingement below the abutment. By applying apical pressure, we attach the mono torque ratchet to the mono screwdriver and apply apical pressure. Using the mono torque ratchet, we torque the abutment screw to the proper abutment torque. We seal the screw access channel with an appropriate material to keep the screw head clean in case we do need to retrieve it at some point. We verify the occlusal clearance depending on the restorative material. Some restorative materials will take more space than others. We align the flat spot on the impression coping and the abutment and snap the coping firmly on the abutment. We need to ensure that the coping is completely seated on the abutment before the impression. We start our impression with a flowable impression material down near the gingiva. We follow this with a medium or heavy body material to fill the tray. Once the material is set, we remove the impression from the mouth and inspect. We're looking to make sure that the coping is fully encased and it's firm in the impression. We then take the easy abutment analog, align the flat spots, and insert it into the impression. Want to verify that the easy abutment analog is completely seated in the impression coping. It should be firm and stable. After returning to the patient, we can place a temporary cap on the abutment, or a temporary can be made with a vacuum or silicone matrix. Want to learn more? Our local customer service teams are standing by.